I work in outpatient ortho, neuro, and pelvic floor, and that means a lot of geriatric low back pain patients. And a lot of them cannot tolerate standing for prolonged periods of time, and I mean more than like 10 minutes. Obviously, we see a whole variety, and this does not apply to every single person. Here are some of my favorite exercises to work on spine mobility in all every which one way direction, and just general movement and mobility, especially if they cannot tolerate standing. This would be for someone with lower irritability and no radiating symptoms into the legs with directional preference. But a lot of the time I do think greater exposure into certain movements is good and beneficial as long as it's not increasing their pain. These are such simple movements that so many people lack. And sometimes we just gotta bring it to the foundations and the basics. And we cannot forget about the thoracic spine. This is a great exercise I like to use to increase thoracic extension. Because a lot of the times if their thoracic spine is limited, they're probably gonna have shoulder pain or shoulder limitations. I frequently check in with my patients to make sure they're just feeling pulling and tension sensations and no sharp shooting pains or radiating pains. And of course, we want to strengthen the hips with classic hip abduction, but they're going to want to compensate with moving their foot out and not their knee. So I always cue them for knee first, foot follows to really get the hip abductors. Have fun.